Here now is Dr. Renee Matthews, physician and medical educator. Dr. Matthews, thank you so much for joining us this Christmas.
Thank you for having me.
All right, let's get right to this because obviously there are countless American families who have been devastated by this opioid epidemic. I know certainly they're paying attention to this report right now. So can you tell us exactly how something like this actually works?
So it's a test that it has to be done by prescription. And of course, you have to have the patient's permission. But this test has actually been tested on 385 people. And 80% of the time, it was accurate to say that that person would possibly get an addiction. And 83% of the time, it ruled out that they wouldn't. So those numbers sound good to me.
Yeah, that's
now where there is a small discrepancy with ethnicities, though. They said 81% of the time it was accurate with whites, but 92% it was accurate. It was accurate with blacks. So
That's very interesting. That was my next question. How can we actually believe that this is dependable and accurate? 80 to 85% is basically what I heard you say. So very, very important and very good accuracy. Let's talk a little bit about just moving forward. Is this ready to go, or do we have to wait at all for this test to become more mainstream?
no, this has been approved. So I'm presuming the doctors will start asking patients to take the test before they prescribe them any kind of painkillers for, after surgery or anything like that.
Fascinating and a game changer for so many families. All right, to our next topic. We've known that smoking is bad for our lungs, but a new study actually shows cigarette smoking causes the brain to actually shrink. Doctors are calling on smokers to stop, adding that e-cigarettes and vapes are not considered a safer or effective way to stop smoking. So what are the risks when the brain actually does shrink?
Dementia, Alzheimer's disease. Those are the two big ones when you have brain shrinkage. The good thing is that if you stop smoking, you can stop that shrinkage. The unfortunate thing is that it cannot be reversed.
There are so many smokers that are out here that are watching this story. They may be wondering, oh my gosh, is it already starting to me? Is my brain shrinking? Do you have a certain cutoff point for a smoker to have a healthy brain?
No, they said the more you smoke, the more cigarettes you smoke per day is what increases your likelihood of having these problems. So anyone who's a current smoker is at 40% risk of having dementia and 30% risk of Alzheimer's. So I would say quit smoking.
All right, 'tis the season for some of those coughs and colds that we're seeing, that tickle in the throat or the endless blowing of the nose. It might be one of three illnesses. And for all of them to be coming out in full force, that's certainly the case in my family. Respiratory illnesses like RSV, the flu, and COVID, they're all trending upward nationwide, threatening a lot of Christmases and New Year's coming up. How do we know which is which when we're talking about these three big ones, and what should we be doing to sort of combat them?
So the unfortunate thing is they all really do look alike. The one thing is COVID often does come with a loss of taste and smell. So that's the only outlier. Now, COVID, you can test at home. The other two, you have to go to a doctor's office for a test. So if you have any signs and symptoms, I highly suggest you get a COVID test and test at home. And then if that is negative, then you go to the doctor so that you can hurry up and get treatment.
Like I mentioned, my little niece has a long-lasting cold or flu right now, fever. I'm sure she's not the only one out there. How are these pediatricians, doctors' clinics, and hospitals looking right now?
Very full. There's a lot of RSV. RSV really affects the elderly as well as the younger population. So those in the middle aren't too bad with it, but there is an RSV vaccine out there that a lot of the elderly population have been getting, and it is very effective. So, and of course, we have our flu vaccines, and of course, we now have COVID vaccines. So protect yourself. I still wear a mask when I fly. I still wear a mask in places that I feel are crowded with lots of people. And if I notice somebody start coughing or sneezing, so just take precautions. And during these holidays when we're with family, please try to make sure you're healthy before you go to your family's house, especially if you're going to have your seniors there.
Yeah, good advice. Obviously, we learned so much during that pandemic. Wash your hands, wear a mask when you're around others. Still good advice to this day, 2023, heading into 2024. Yes. Dr. Renee Matthews, physician and medical educator. Thank you so much. I love the sweater. Merry Christmas to you.
Thank you. Bye.
A major population